Hello students, myself Dr. Maddineni Srinivas, certified dermatologist from India discussing derma-related topics, and this is today's MCQ. A 20-year-old man presented to the casualty department with chest pain. What is the most likely childhood diagnosis associated with the findings of this coronary angiogram? And if you look at the angiogram, you are able to see some dilatation is present in the coronary arteries. We can call this as coronary aneurysm. And on the right hand side you are able to see that the tongue is appearing very red in color, and you are able to see that there are some prominent papillae which are present, and this is called as strawberry tongue. So this coronary aneurysm combined with strawberry tongue, we should always think about the diagnosis of, yes, it is Kawasaki disease. So here the answer is Kawasaki disease. So there are some very important mnemonics for Kawasaki disease. The first one is crash and burn. So basically C stands for conjunctival injection, that is conjunctivitis. R for rash, A for adenopathy, S for strawberry tongue, H for hand and foot, edema and erythema. And a few points about these features. The conjunctivitis is non-purulent variety of conjunctivitis which is seen in Kawasaki disease. Rash is maculopapillar, it can be erythema multiforme like, it can be any type of rash except for vesicular rash. That is the most important thing which you must remember. And what are the parts which can be affected? Palms, soles, and also the trunk. All of them can be affected. And lymphadenopathy is most likely seen in the cervical area, and this is also seen only unilaterally, and the lymph node should be more than 1.5 centimeters to be considered as Kawasaki disease. And strawberry tongue, of course, we have seen the picture, and oral fissures, buccal mucosal erythema, and lip crusting can also be seen. And hand and foot edema, erythema, and also there will be periangual desquamation which can be seen post the post fever, that is after 2 weeks of the fever. And fever is going to be persistent more than 5 days. And along with this fever we call it as burn here, okay, in this mnemonic. So along with fever, 4 out of these 5 criteria if they are present, then we can consider and categorize these patients as Kawasaki disease. And this is another mnemonic. Instead of crash and burn, here the mnemonic is cream. So C again is conjunctival injection, R is again rash, E is edema of the hand and feet, A is again adenopathy, M is mucosal erythema and crusting. Again fever will be there. So this is just another mnemonic, cream. Can anyone tell me what is the most important medication which can be used in these patients to prevent the coronary artery aneurysm? So please type in the answer in the comment section below. And this is tomorrow's MCQ. Please pause this video and try to answer this MCQ. So I hope this video was helpful. If it was helpful, please do not leave this video without giving a like.